Imagine you wake up tomorrow morning and discover that all bone in your body has been tightly glued together like they have been glued by the super glue. Then would you still be able to move your body normally? Of course not. So what's the secret that allows our bone to move with each other? Exactly, the answer is joint. Today we are going to discover how amazing parts of body allow us to move, bend, rotate and do all the things that we normally take for granted. Look at your fingers. There are several bones in one finger. Why don't these bones just get separated and how they bend? And can you find the place where two bones meet? That's where our journey into the world of joint begins. Okay, simply joint is a junction between two or more than two bones or the cartilage. It is also called the articulation or arthrosis. Joint helps to increase the length of bone and help in the movement. It is the weakest part of the skeletal system. It allows the movement of body, provide the stability, hold the bone together, support the weight of body, transmit the forces, protect the internal organ by acting as a shock absorber, helps to maintain the body posture and alignment etc. Various types of joints are found in our body. It can be broadly classified into fibrous, cartilaginous and synovial joint on the basis of tissue connecting the bone, that is the structural classification. Functionally, it can be classified as synarthrosis, amphiarthrosis, and diarthrosis, which is based on the degree of the movement. Synarthrosis are the immovable joints, amphiarthrosis are slightly movable joint, and diarthrosis are freely movable joints. So we can say that fibrous joints are analogous to synarthrosis, cartilaginous joints are analogous to amphiarthrosis, whereas synovial joints are analogous to diarthrosis. Now let's discuss the structural classification of joint in brief way. The first one is fibrous joint. The fibrous joint is a joint where the articular surface are connected by the fibrous connective tissue. There is no presence of joint cavity. It is immovable type of joint. It is mainly found in joint of the skull. It can be further divided into suture, syndesmosis and gomphosis. The articular surface of the suture fibrous joint are connected by the sutural ligament, which is generally immovable. It can be further divided into plain, serrated, dentate and squamous suture. The articular surface of plain suture is plain and smooth. Example is internasal joint, plate, maxillary joint. The articular surface of the serrate or limbus suture is saw-like appearance. So, example is sagittal suture, coronal suture, etc. The articular surface of the dentate suture is tooth-like appearance. Example is parieto-occipital joint. And the articular surface of the squamous suture is flat and overlapped. The example is parieto-temporal joint. The articular surface of syndesmosis are connected by the thick connective tissue or membrane which are slightly movable. The example are interosseous radioulnar joint, interosseous tibiofibular joint, inferior tibiofibular joint. The gomphosis or peg or joint socket are the joint of which the articular surface are connected by the periodontal ligament. The example are joint between teeth and alveolar socket of the maxilla and mandible, which can be seen in the figure. Now let's move to the cartilaginous joint, where its articular surface are connected by the hyaline or the fibrocartilage. There is no joint cavity present as similar to the fibrous cartilage. It can be classified into two different types, that is synchondrosis and symphysis. Synchondrosis or primary cartilaginous joint are joint where the articular surface are connected by the hyaline cartilage, which are the immovable type. The example includes the joint between epiphysis and metaphysis of the growing bone, between sphenoid and occipital joint, first chondroesternal joint, costochondral joint, etc. Secondary cartilaginous joint or symphysis are those joints which articular surface are joined by the hyaline cartilage along with the pad of the fibrocartilage. The example includes symphysis pubis, intervertebral joint, etc. Now let's discuss the most common and clinically important joint, that is synovial joint. The articular surface of the synovial joint are connected by the fluid-filled cavity called the synovial cavity. They are mainly present in limbs. The structural and characteristic feature of synovial joint includes The articular surface of the synovial joint is lined by hyaline cartilage. Articular surface are separated by a cavity called the synovial cavity, which is lined by synovial membrane, as you can see in the picture. The synovial membrane produces the synovial fluid in the cavity. The joint is encapsulated by the fibrous capsule. The joint is supported by the ligament, tendon, and muscle, and some joint the articular disc separate the articular joint surfaces. Now let's move to the types of synovial joint. They are plain, hinge, pivot, ellipsoid, condylar, saddle, and ball and socket joint. Plain synovial joint. The articular surface are plain, flat, and unaxial. It is also called the gliding synovial joint, where the side-to-side movement occurs. The example includes the following, which is seen in slide. I have made a mnemonics that helps to remember the example of plain synovial joint, which says, I met very intelligent made student at capital school. The first letter of the sentence reflects the example of this plain synovial joint, where I stand for intertarsal or intercarpal joint, M stand for metacarpal or metatarsal joint, V stand for vertebrocostal joint, I stand for interchondral joint, M stand for metatarsal joint, S stand for sacroiliac joint, A doesn't stand for anything, C stand for chondroesternal first or carpometacarpal first joint, and S stand for superior tibiofibular joint. Now let's move to hinge or gingimos joint, where the articular surface are pulley shaped and are uniaxial. The example includes elbow, ankle, and interphalangeal joint. The third one is pivot or trichord joint, where the articular surface of one bone is rounded and another is with concavity, and it's also uniaxial. The example is superior inferior radioulnar and atlantoaxial joint, that is C1 atlas and C2 is axis. Then fourth is ellipsoid joint, whose articular surface are slight concave or convex and it's biaxial, that is flexion, extension or abduction. Adduction is possible. The example includes a wrist joint, a metacarpopharyngeal joint, accept first, atlanto-occipital joint. It can be remembered by WMA, UMA. And the fifth one is condylar joint. The articular surface are made by the bony mass or condyle. It is also biaxial, and the example is knee and temporomandibular. It can be remembered by KT. The sixth is saddle or solar joint, whose articular surface are saddle shaped, that is concave, and it's multiaxial. The example includes the first carpometacarpal joint, sternoclavicle joint, calcaneocuboid joint, incudo-malloid joint, and between the femur and patella, that is femoropatellar joint. It can be remembered by a mnemonics which says cute cat in the forest. The final type of synovial joint is ball and socket joint, whose articular surface are round and cup shaped and have a high range of motion, which is commonly dislocating joint. The most commonly asked MCQ from the synovial joint be like, which of the following is most commonly dislocating joint, and you have to tick the shoulder joint, which falls under the ball and socket joint. So you have to remember, and it's multiaxial also. Example includes the shoulder joint, which is commonly dislocating joint, hip joint, talocalcinonavicular joint, incudostapedial joint, and talocalcaneal joint. The example can be remembered by the mnemonics called SIT, SHITT. S means shoulder joint, H means hip joint, I means incudostapedial joint, and TT means talocalcaneal and talocalcaneonavicular joint. If you are confused in the terms like uniaxial, biaxial, or multiaxial, this table shows the clear information about it, and it also separates the various type of synovial joint on the basis of range of motion. so it's useful, you can use it.